Hello everyone, today we are going to study about the case-based discussion on the topic of bond. We will be seeing the case of the bond and know about the what we have to do investigation and the diagnosis and other thing also. So let's go with the case. So in our first case, at 2 p.m. a 33-year-old lady from the Bonepa, Cabre, brought to the emergency department with blisters and erythema at her right anterior trunk and the right anterior forearm and part of external genitalia. What additional information would you like to ask? First, here is given that there is a bone in the right anterior trunk and the right, which you can see in the figure also, anterior right forearm and the perineum, external genitalia. And so, for the calculation of the total body surface area, there is a rule of 9 formula, as it says that for the head and neck there is 9%, and for the trunk 9%, abdomen 9%, and for the limb 4.5, and for whole one limb it is considered as 9% for the upper limb and the lower limb also. So for the calculation of the involved total surface body area which the bone is affected, so we have to calculate in the right anterior trunk 9% and the anterior right forearm which is 2.25%, as we have talked that 4.5% is for the whole limb, then for the half then 2.25%, and for the external genitalia and the perineum it is given as 1%. So for the calculation of the total body surface area involved, 9 plus 2.5 plus 1% is 12.25% along with the Wallace rule or rule of 9. So here the mode of injury, including the information about the scene at particular period of the injury, and we have to ask the time in contact with the bonding material, how much time with the bonding material has contact with the body surface, and any other associated trauma, and the initial first aid in the trauma has given to the patient or not, we have to ask, and if there is pain in the bone area, we have to also ask about that. So other information in the case is like her clothes got on fire while cooking food this morning around 9 a.m. as she is taken to the hospital at 2 p.m. So at the 9 a.m. She got the burn and the consulted local health center where one dose of intramuscular analgesic was given and referred to the hospital, and her weight is 60 kg and passed few milliliters of the concentrated urine about an hour ago. So what could be the most appropriate diagnosis? For writing the diagnosis, we have to first write the how much percentage of the total body surface area is involved. Like in this case, 12.25% of the total body surface area is involved, and what causes that bond, like involving flame bond. So first percent, and then the cause of the bond, what type of bond, like flame bond, and the thickness, like penetration or depth of the bond. We have to include these three: first, body surface area involved, and the cause of the bond, and the depth of the bond. So 12.25% of the total body surface area involving flame bond, most likely superficial partial thickness bond, as most of the flame bond are superficial partial thickness bond. Okay, so where is in the schema are you now? So as for the protocol, following of the protocol in the bond, we have up to like bond and then the flame bond. So what physical finding will you expect on her? Like on bone area, erythema, blistering, and the chared skin, and this swelling and pain in bone area can also be found. And the clinical feature of shock, like pale, cool, and clammy skin, rapid and weak pulse, and the low BP can also be found. And the clinical feature of the dehydration can also be seen. And we have to always rule out that if there is inhalational injury. So how we can rule out that inhalational injury in this case is like if there is any history of the patient is in the closed room, and any history of the like sputum in the sputum, that black colored sputum or the coal particle is present in the sputum, and if there is bond in the nozzle here, that type of feature if seen, then we have to suspect that there is presence of the inhalational injury. So we have to rule out that also in any kind of the bond. So for other information, on physical examination, C is in pain and shivering, and the blood pressure is 100 by 50 mm of Hg, and the pulse is 110, and respiratory rate is 14, and the temperature is of febrile. So how do we proceed to manage this case? So we have to always do the primary survey and the resuscitation. For the resuscitation, FAAT rule: first fluid, then the antibiotic, then analgesic, and then tubes are done parallelly if needed. So for the secondary survey, and then remember, like for giving the fluid, there is the formula called Parkland formula. Although these Parkland formula are being replaced by other, but mainly these are mainly used in our hospital, so we have to know about this Parkland formula. So in the Parkland formula, the formula is how much fluid we have to give to the born patient. It is depends upon like the body surface area which is involved and the weight of the patient. So the formula is 4 milliliter into weight in kg into percentage of the total body surface area burned. So for the calculation in this case, as we have talked that 60 kg of the patient is coming and the total body surface area is 12.25%. So we have to give the 2940 milliliter of the fluid to the patient in a 24 hours. So how we have to give this fluid is that 50% of this fluid must be given at the first 8 hours. If the patient like in our case, the patient have born in 9 a.m. and she has come in the hospital at 2 a.m. then 10, 11, 12, 1, 2 minutes. It means that 5 hours later she came to the hospital. So as the formula that we have to give the 50% of the fluid at the first 8 hours. So only 3 hours is remaining for getting the 8 hours. So we have to give that much fluid in the 3 hours, like 50% of the fluid must be given in the 8-hour period, and then the other 50% of the fluid is given in the next 16 hours of the 24 hour. And there is also some question that in the second day how much fluid we have to give to the patient. So for that 40 to 60% of the first day fluid is given in the second day. So mainly like 50% of the fluid can be given to the patient in the second day of the burn after the calculation of the fluid requirement by the Parkland formula. So we have to remember 8, 16 and 24. Like formula of the 8 1s are 8, 8 2s are 16, 8 3s are 24. For the 8 hour 50%, for second 16 hour 50%, and for 24 hour 50%. So you can remember the fluid, how much fluid you have to give to the patient of the burn at the first day and the second day. So what investigation would you like to do if needed any? So for the investigation, we have to always send the baseline investigation, and the chest X-ray should be done. That we have to rule out that if there is inhalational injury or not, and the wound culture and sensitivity can also be given, as there can be any suspicion of the infection, as there is high chance of infection in the burn wound. So we have to do that. So what are the admitting criteria did you see in this case? So for the admitting criteria, if there is the suspected airway or the inhalational injury, any burn likely to require fluid resuscitation, as in the children with the burn over 10% total body surface area, and the adult with burn over 15% of the total body surface area, and the oral fluid may be used in the first aid setting or mass casualty incident. So anyone likely to require surgery also have to be admitted, and the patient with burn of the hand, face, feet or perineum. So in our case also there is the like patient is having the burn in the perineum and the hand and also, so it is the criteria suggesting that the patient must be admitted, and the patient whose psychiatric or social background make it inadvisable to send them home, then they are also be admitted to the hospital. And any suspicion of non-accidental injury, so they are also must be admitted, and patient at extremes of age are also the one of the criteria to admit the burn patient in the hospital. So any burn with associated potentially serious sequelae including electric burn or chemical burn is also another category. So this is the first case. So let's go to the second case. A 45-year-old gentleman weighing 50 kg come to the emergency department with the complaint of painful erythematous face resulting from fire that start when he tried to lit a cigarette and his neck scarf gets sets on fire and could not remove till it burned completely. So first, like we have to age and the weight of the patient must be known, must be required in the history, and then we have to ask what is the cause of the burn in the patient also, and other history also can be asked. So as there is presence of the scarf burn and there is burn in the face and the neck, so from the according to the Wallace rule of the 9, we have to if there is involvement of the both head and neck, it is given as 9% for the this type of burn. If only neck, then we have like in the rule 1%, but if there is involvement of both head and neck, we have to give the 9% total body surface area for this patient. So history of being trapped in a burning room, so it suggests that inhalational injury can be asked, and change in voice and the difficulty in breathing, time since injury, and the pre-existing illness, drug therapy, allergies, and the drug sensitivity can also be asked. So other information like what physical examination finding do you expect in this patient? So there is burn in the neck and the face, so deep burn around the mouth and the neck can be found. Burn on palate or nasal mucosa or loss of all nostril hairs, so it suggests the inhalational injury. And the carbonaceous sputum and wheezing also suggests the inhalational injury. And the difficulty in breathing, increased respiratory rate, accessory muscle use, and the respiratory system examination can also be there. And the altered conscious level, GCS score is altered, and the progressive hoarseness and stridor which may develop over 12 to 18 hours, and they are very late symptom of airway obstruction. So if there is like hoarseness and the stridor, then the severity is more, and the maybe burn is very late coming to the health facility. And the deep circumferential burn around neck and chest wall can also be found in the patient, as if there is the circumferential deep circumferential burn, then there is like whole circumference of the scar formation, so that there can be like compartment syndrome and other compression syndrome also. So we have to suspect that also if there is whole circumferential burn. So his vital signs are within the acceptable limit, except respiratory rate, which is increased to 22 per minute. What is the most likely diagnosis in this patient? As I have already talked that for the diagnosis, first we have to write the total body surface area which is involved, and then the cause of the burn and the depth of the burn. So here 9% total body surface area involving flame burn with inhalational injury, and there can be like superficial partial injury in this case. So these three things must be included while writing the diagnosis. So where in the schema are you now? Then here is the burn and scar or flame burn, and then suspected airway injury. And what are the key points that make this case different than the previous one? So in the previous one, there is the involvement of the 12.25% of the body surface area, but in this case only 9% of the total body surface area is involved. And the flame burn associated with airway injury has high mortality. So always there is also, I have already talked about that, the hospital admitting criteria is also one of the inhalational injury also. So because it has more high mortality rate, and in this case like diagnosis to consider are upper and lower airway injury, because there is suspicion of the inhalational injury in this case. So this is the second case, and for going to the third case, a 12-year-old boy, while trying to get a kite hung on roadside electric wire, get electrocuted and fell down from a 5 feet high wall. So what additional information would you like to get? If there is a history of any electrical injury, always ask the voltage, what kind of voltage, like electric sources, high energy or the low energy tension of the electric sources is it, and the time of contact, how much time that there is the contact with the electrical sources, and where they thrown away from the electricity, as that electricity push it away, or the other people supported to pull him, and the other associated trauma in this case. So he was complaining pain at left knee, and which was swelling. Pulse of the right index finger is gangrenous, and his right big toe get small cut-like injury. So what physical examination do you expect in this way, and how do you explain the above finding? So the pulse rate is increased and the feeble in the volume, and the entry and exit wound, here, right index finger and the right big toe. So we can suspect that at the right index finger there is the gangrenous finding, and in the right big toe there is cut injury, as we can suspect that it can be like in the right index finger there is the entry point of the electrical current, and the right big toe can be the exit point of the electrical current, because here is gangrenous formation, and at the exit there is less heat production, which can cause the cut injury at the right toe of the right toe. So skin for burns and blister can be checked, and the neurological function can be deranged, and the left knee examination, there can be also a dislocation of the fracture, as he has fallen from the 5 feet height. And remember, here entry point is right index finger and exit is right big toe. Right index finger gangrene could be because of the blood vessel injury causing ischemia of the distal part, necrosis, and finally the gangrene. And the cut-like injury in right toe could be because of the burn due to the electrical exiting out. So what investigation would you like to do in this case? We have to do the ECG, and the basic serum electrolyte can be done, and the ABG can also be done, and X-ray of the left knee, as there is history of the injury, so we can do that also. So his ECG seems normal, and the urine is light yellow, and X-ray left knee showed soft tissue swelling with the normal bone knee structure. And what is your diagnosis? For the diagnosis, first we have to write the percentage of which is involved, and the cause and the depth of the injury. So 1 to 2% of the total body surface area involved. Cause is electric burn, and the full thickness and soft tissue injury, as in the most case of the electric burn there is full thickness injury. And where in the schema are you now? So burn, electrical burn, and the high voltage injury. So this is the case 3, and let's go to another case. So 5-year-old baby girl weighing 21 kg brought to the emergency department with the history of burn with boiled milk on her bilateral anterior thigh. So first we have to see that the patient is a pediatric patient or not, so that it will helpful in the calculation of the other fluid management and the other thing also, and total body surface area also, and the weight is also required. So here in the thigh, percentage of the thigh is burn due to the skull burn, as the skull burn is the most common cause of the burn in the our country, as there is many cases we have to also see in the hospital also, and small children like pediatric patients are more vulnerable to skull burn in our household setting also. So here total body surface area involved is 8%, as 4% and 4% for the thigh, and the whole is 8% is involved, and duration of the contact and the times is burn occurred should also be asked in these cases. and first aid treatment if any has done in this case or not, so we have to ask that also. So other information is like she is crying and at the same time passing urine on bed while you are examining, and why after investigation we like to send, so we have to send the basic in baseline investigation, and she is admitted but having poor oral intake. So how do you calculate the fluid requirement on her? So for the calculation of the fluid requirement from the Parkland formula, as I have already talked, 4 milliliter into the weight into the total body surface area involved due to the bond. So that can be given in the 24-hour, and first 8 hour 50% must be given, and later 16 hour 50%, and the second day 15%, 50% must be given. So in the pediatric, we have to give the dextrose solution, dextrose saline to the patient. In the adult, we generally do not give the dextrose, but in the patient, like there is deficient of pediatric, there is deficiency of the glycogen, and this 4% glucose in dextrose saline can be given in the maintenance fluid also, and the 100, 50, and the 20 rule must be applied in this case. So as these are the case we have discussed in the bond. So mostly if the patient come to the hospital of the acute bond, the host come to the hospital, then we have to make the bond in the running water. Most ideal temperature is the 15 degrees Celsius of the water, but we do not have to put it in the ice because it can cause the vasoconstriction and causes more coagulation of the bond site. So running water must be preferred for the 30 minutes, and then the cleaning of the wound by the chlorhexidine solution and the other solution, and then in the if the bond is superficial only, then we do not have to add the lotions like sulfur silver nitrate lotion, but if the thickness is more, then we can add that amiopuration and this type of rock, and then Vaseline gauze and corlicks, and then bandage can be applied, and then if there is deep one, then we have to do the skin graft to preserve the body. And so these are the things which you need to know in the bond. And thank you everyone for helping me to doing this, and